Universal health care is a central talking point for many Democrats in the race for the White House. But what would it look like and what would it cost? Opponents of such a healthcare overhaul say it would break the bank and could lead to a lower quality of life and healthcare for all. Proponents like economics professor Robert Pollin, co-director of the University of Massachusetts Political Economy Research Institute, say universal health care is economically viable. He sat down recently with Carolee McGrath to share his perspective.
Basic features of Medicare for All are, number one, that every resident of the country is covered with good quality health insurance. They all have access to good quality care, which is not the case now. And then the second feature of it is, because of the way it's designed, you also save money. Right now, the U.S. spends roughly twice as much as other advanced economies per person on health care, and Medicare for All would lower costs and extend coverage for everybody.
Okay, so all private insurance goes away.
Yes.
So any plan that a person currently has through their employer that they like, they don't have anymore. They're put into a government system. That makes some people worried.
Right. It depends on how you ask the question. If you say, let's take a middle-class person. If you say, right now, you're spending $8,000 on health care. Now, under Medicare for All, you're going to spend $800 a year on health care, and you're going to get to choose all your doctors, all your providers. Which one would you rather have?
And then they might say to you, how much are my taxes going to go up? Because a few different studies have talked about $32.6 trillion over the first 10 years. And that's from conservative groups and from sort of the center groups as well.
No.
Or that's from you. Okay.
No. So, yeah, but what you forget is, under the system we have now, for the 10-year projection, we're looking at $55 trillion. So this is actually a big savings. That's the thing that people forget. When they make these comparisons, like some of the politicians, I won't mention names, make comparisons, they say, well, this is going to cost $35 trillion, or this is going to cost $50 trillion over 10 years. And they're not off in terms of the broad range, but the private health insurance system, dominated system that we have now, is more expensive.
So you're
that's
saying over the next 10 years, the system that we currently have, if we did nothing else, will increase to 55 million. Is that what you just said?
Not million,
Trillion?
trillion. Yes,
Okay.
yes.
So if nothing is done.
Well, this is the estimate of the U.S. government. The Center for Medicare and Medicaid, their estimate is, if we maintain the same system we have now over the next decade, it will cost for 10 years roughly $55 trillion.
So the 32.6 trillion that you're talking about, so now this all gets doled out, into taxes. How is this paid for versus how is the system that we would currently have continued to be paid for? Because part of that is private insurance. So that would be paid for by people who have their own insurance. But your plan, or the plan Medicare for All, would then be divided by everybody. How would that work?
Well, there's various ways. So basically, we're saying we have a system where everybody gets covered, and you have to pay for it. Now, in the current system, just to break it down, because when you get these aggregate numbers, they're so gigantic, a million, trillion. So let's break it down again to an average middle-class household. The average middle-class household now is going to pay, on average, about $8,000 a year through premiums, through out-of-pocket, through deductibles, through copays. And that's what they pay. That's money that they pay. Now, under the way at least I designed Medicare for All, they would pay about $800.
Okay, so what is their tax differential there?
Their tax differential is they would pay $800 in taxes.
That's it?
Under my thing, yes.
Okay, when you say under your thing.
It's the way, well, I was basically asked to write a proposal by Senator Sanders based on his 2017 bill. The bill's changed, so now there's a new bill, 2019, and so the details will change. But roughly speaking, what we're talking about is, yes, you will pay taxes But the taxes you pay, let's say the $800 in taxes, are going to be a whole lot less than what you're now paying for health insurance, premiums, deductibles, co-pays, out of pockets.
Okay, so other studies have said that that is not the case, that people will pay, a lot of people will pay more in taxes so that they would
Actually,
be
that's not
worse
true.
off. Well, some, including the
Yes.
Heritage Foundation, is one of the
Well,
studies.
if we want to look at a very conservative think tank, the Mercatus Institute, funded by the Koch brothers at George Mason University, they come to a result that's roughly similar to mine in terms of the net cost, that the cost will go down. In fact, just a couple
Actually, they also said that the reimbursements for medical providers would also go down, which would be a big challenge. So they didn't exactly completely agree with your report. There were some definite discrepancies.
There are definite differences in terms of the details,
Yeah.
but in terms of the aggregate spending numbers, they aren't as low as mine. But there actually was a new study that just was published 2 days ago that looked at about 12 different studies, including mine, including the Mercatus Institute, including the Urban Institute, and I think, I might not get it exactly right, 11 out of the 12 all say that costs go down. And these are across the political spectrum. The costs do go down basically for two huge reasons and then some smaller ones. The two huge reasons are you get rid of all the administrative waste, excessive administrative activity that are built into our existing system.
With the government? Because a lot of people would say that's impossible. There would be so much administration with a
No.
government-run program.
Actually, we have a very easy way to compare. Medicare, existing Medicare. Existing Medicare, the administrative costs are about 2% of overall costs. With existing private health insurance, overall administrative costs are about 12%. So that's a fair comparison, 2% versus 12%. And the second big source of savings is pharmaceutical prices. Right now, on average in the US, we pay roughly twice as much as they pay in Britain, Germany, Japan, France, for the same drugs, because we don't intervene in the market in the way they do. And so the drug companies basically exercise this market power, and people pay twice as much.
How would hospitals be able to provide the care that you're saying that they can provide if they are reimbursed at a lower rate? How would they remain profitable and be able to care for people in a way that people would need to be cared for?
The hospitals are really not going to be affected per se. What gets affected is the insurance provision. So the hospitals actually are going to save money because they themselves also will have lower administrative costs. Because right now, hospitals, providers, doctors' offices, they have to deal with this labyrinthine insurance system. There's multiple payers. There's all kinds of different rules. There's ways in which you get approvals that are different. There's doctors that are within the plan, doctors that are not within the plan. That all ends up taking a lot of administrative time. So the hospitals are going to end up saving money on administration as well.
Okay, Mercatus did indicate, though, that there would be a 40% lower reimbursement rate. So what were they talking about?
I don't know. That number is not correct. I actually was in touch with the author, Blayhouse, about that. I mean, if we assume that all doctors are paid at existing Medicare rates, okay, my estimate is that per patient, every doctor gets, on average, a 7% lower reimbursement rate. Not 44. I don't know where he got 44%. Now,
obviously, he disagrees because he had published that in the report.
Yes, he did. And but I can tell you how I got my number. And then on top of that, which he did not factor in, under Medicare for All, there will be more coverage. People will go and use the system more, which means there'll be more demand for physician services. In addition, the doctors will be released for a lot of the time that they now spend filling out forms. So that will give them more time for treating patients, billable hours. I myself talked to my own primary care physician, and I asked her, She said she spends 20% of her week filling out forms.
I think one of the big concerns for people is who disagree with you will say that, a government-run healthcare system would lead to rationing of care. Right off the bat, when we started this conversation, you said that people will have better healthcare. A lot of people doubt you and say, look, if we're all put into one system, it's very possible that somebody who, maybe an elderly patient or might be kind of pushed to the side. How do you respond to people who have those concerns?
Well, look, we already have Medicare. It's been operating since 1965. People like it. You mentioned elderly people. Elderly people are all in Medicare now. And, of course there's problems, but generally speaking, it works pretty well. So we could extend that model and say, well, that's going to be available to everybody.
Could there be rationing of care?
Of course, there's rationing of care now. Here's how we ration care now. If you don't have enough money, you don't get the care. That's why, 27% of the population that has insurance, doesn't get the care they need. Because even with insurance, they can't afford to pay for a doctor's visit or to get the drugs that they need, that they're asked to get. So that's the way that we ration now. The way that we would ration under Medicare for All would be more egalitarian. Everybody would be covered, and we would save money. We would not have this massive administrative burden overhanging on the whole system.